Welcome to Adapt NCLEX. The NCLEX is not a random test. Here is a rare breakdown of 85 questions and what you must focus on to be able to pass these exams. I'm going to use client needs using NCLEX review questions, practice questions, and questions and answers. And we go through all the client needs. Then at the end, we're going to deal with some fundamentals. So stick around and let's get this done. First question is NGN Next Generation Case Study. How do you answer case study? Focus on the buzzword. And this is the question. We're going to read it. Look at the way I'm going to approach a case study. Always read the thing, and the first two sentences is what you should focus on. A 72-year-old male is brought to the emergency room by emergency medicine team, right? After his wife report what? Sudden slurred speech, right-sided paralysis, and he grabbed his head like he had the worst headache of his life. Those sentences should give you some idea what you're dealing for. And then you decide to go through all the questions, all the information given you, underline the buzzword, and know that this patient came in because of what? Right-sided weakness. He grabbed his head. He has worst headache of his life. He has a slurred speech. Something should be ringing in your ear. And this began 25 minutes ago. We are running out of time. They give you past medical history. Just glance through. Don't bother yourself too much. Some of them may not be necessary, but check. You read it and you say, I know this, hypertension. And so what? AFib. Oh, I got to worry about it. He has stopped taking his medication. That's not good. Hyperlipidemia. Bad problem. He has never had stroke or anticoagulation. Then you said, look at the vitals, find abnormal one and check it, circle it. Blood pressure, too high, 210, 110, right? His heart rate is also high, but what? Irregular. Why? Because he has AFib, respiratory rate of 22, SAT is 94, temperature is fine. On physical exams, we're confirming the reason why the patient came in. Slurred speech, facial drooping, right-sided hemiplegia. The GCS is low because he has something going on. He grabs the left side of his head and states, my head is exploding. Now go back and said, what is going on with this patient? Put it together and said, he came in with what? Slurred speech, right-sided paralysis, and grab his head. He said, where's headache of his life with what? And they give you time. They're telling you this is fast. And what do you know about fast? Something diagnosis you have to know. From here, you should be able to diagnose the patient, spend few minutes and make a diagnosis. Don't look at the questions before you make a diagnosis. After you make a diagnosis, the rest of it is history. We know what this patient have, right? Which the nurse has reviewed the clinical data. Which of the following findings are concerning? Connect the dot. Right. Slurred speech, what? What else? He has what? Right-sided weakness. What else is going on with the patient? Patient also is having headache. What is going on with the patient? And which of these are concerning? Well, hyperlipidemia, I'm not going to fix it right now. When he asks you what do you worry about, it's something you can fix now. Therefore, don't worry about it. Facial drooping, we can fix it now. Right-sided weakness is a problem. We don't expect that, right? Slurred speech, we don't expect it in this patient. It's fine. All of a sudden, he's showing new symptoms. Worst headache of his life is a bad problem. That is the cause of all his symptoms. And so that's what we deal with. What do you think is the most likely diagnosis, right? What is the client experiencing? The worst headache of my life, all of a sudden, I have a slurred speech, right-sided paralysis, and I'm grabbing my head. And he has a history of hypertension, and the blood pressure is high. That tells you he has something to do with blood pressure. And therefore, you have option: embolic stroke, ischemic stroke, TIA, which is transient ischemic attack, or hemorrhagic stroke. What do you think? I'm giving you an idea that all of them is stroke. I don't want to confuse you. I'll put Bell palsy, but I just left it this way. What do you think? We think this patient has stroke. Is he embolic? Embolic stroke is from emboli, from probably the heart, right? Ischemic stroke, less blood flow to the place. Transient ischemic attack, I will tell you something is falling over the eyes, like a blind falling over the eyes. There's nothing in the statement. Hemorrhagic stroke, Worst headache of my life. This patient is bleeding in his head. It's not an ischemic stroke. It's because of the blood pressure. There is bleeding, rupture of the vessel, and the worst headache of my life is what? Subarachnoid. Therefore, this is a hemorrhagic stroke. Now, if you have a stroke, what are we going to do? Which of the following order should the nurse anticipate? Think about it. Stroke, we got to do what? Be work fast and fast and fast as much as possible. EEG, what do you think? Put down your answer. Let me know if this patient needed EEG. EKG, do you think we need the EKG? Patient has AFib. INR, patient has AFib. Stop taking what? Coumadin or medication. He's going to get a CT, a CT head with what? Contrast. Do we need the lumbar puncture? Think about it. These are the things NCLEX will trap you. This is next generation NCLEX. Clinical thinking and bring everything together. Patient does not need EEG. We are not looking for seizures. Of course, if you bleed in your head, you'll get seizures, but this is not the problem. That's why we're going to put you on medication to prevent seizures like Keppra, right? EKG, of course, patient has AFib. INR has AFib, right? CT, yes, but look at it. Don't jump the gun. Always read the question and make sure it meets the answer choice you want. CT head, you don't jump in. Look at it. With contrast, you don't need CT with contrast. When you're looking for stroke, you need CT without contrast. And then lumbar puncture, you need to get a CT before you can do lumbar puncture. And this patient does not need lumbar puncture anyway, because if you do lumbar puncture and there's ICP issue, the brain will herniate. Therefore, the only thing we need for this particular patient is BNC. Now, I want you to test your EKG. Instead of giving you a separate EKG question, I connect it with that. But this is a strategy how you can broaden your knowledge regarding next generation. Which of the following the nurse should prioritize, right? EKG show the rhythm below. This is it. What do you think this is? Easy or hard? What do you think? What kind of EKG? The best way is to look at the RR interval. Do you think from here to here, this RR interval, are they uniform? If it's uniform, it's a sinus. If it's not, you have your answer. There's two answers. It's either a block or AFib. And then you look if there is a skipping of the P wave. I don't see any skipping of the P wave. I don't even see them. There's a bunch of P waves I can't even figure out. This is what we call atrial fibrillation. The heart is fibrillating through the atrium. Therefore, what do you want to prioritize? This is a concept. I want you to write it down. These 85 questions, I'm trying to teach you things, how you can connect all the things you've learned together. The most important thing when it comes to AFib is what? Ventricular rate control, not anticoagulation. When you see a question, don't jump the gun. Don't let them trap you. Think about it and say, look, I need to do what? Control the rate. The more the rate is controlled, the more the individual will survive it, no matter whether they are in AFib or not. Therefore, anticoagulation, negative. At the same time, this patient is bleeding in the head. Why do we want to do that? Aspirin, negative. We're not going to do that. Atoplex, of course, we don't know whether it's hemorrhagic or what, ischemic, but at least we know based on the signs and symptoms, this is what hemorrhagic stroke. We're going to control the rates with that. Now, how should the nurse interpret the change? What is it? The next day, the patient's rhythm changes to what? This. From AFib to that. Now you can see P waves. You can see now it's a uniform RR interval. It's fine. But we have what? A bunch of P waves that look like a saw-toothed. Do you see the saw-toothed? Let me show you. There's a saw-toothed here. Look at it. If you draw a line here like that, it looks like saw-toothed. Like that, and then you bring the saw there. That is a saw-toothed features of a regular rhythm with a bunch of P waves. You can distinguish between them, but they were defined. This is what we call A flutter. A flutter is this patient improving or worsening. It's a concept. Think about it. AFib, everything is chaotic. A flutter, everything is organized. That means an organized rhythm is less likely to clot cause emboli or cause your hemodynamic issues. Therefore, A-flutter is much better than AFib. So the patient moved from AFib to A-flutter. Therefore, it shows that patient is improving. The CT confirmed left intracerebral hemorrhage, bleeding in the head with a slight shift midline. That means we have bad head injury. Which order should you question? Bleeding in the head. The next question. Keep the systolic blood pressure less than 160. Start nicardipine infusion. Start IV mannitol or begin heparin infusion for AFib. The patient is bleeding in the head. Do you think they need any more heparin to let them bleed more? Number one, that is a very important thing to know. If it's ischemic stroke, you don't want to drop the blood pressure too much. If it's hemorrhagic, you want to keep the blood pressure not normal, but still slightly lower, right? Less than 200 or less than 180, right? You don't want to drop it to 100. Otherwise, that's the problem. The patient needs some perfusion. So less than 160, 150, 140 is okay. We should not keep it less than 100, right? But heparin infusion for AFib is a problem. We should intervene at all costs. So these are little things I want you to pay attention to, and you can use it to answer these questions, next generation questions. I know you got it, and this is the way you should approach them. Next question. Buckle up. Let's go. Look at what we're going to do. Same strategy. A 55-year-old client receiving chemotherapy for breast cancer report what? Fatigue, sore throat, no nausea or vomit. Report chills and night sweat. Once again, go back. Figure out, I did not give you too much history. I want you to think about the buzzword. It's 55. Okay, I don't care about it. Chemotherapy, I care about it. For breast cancer, I don't care about it. Report what? Fatigue and sore throat. Those are the things I'm worried about. So I have chemotherapy, fatigue, and sore throat. Bad combination. He has no nausea and vomit, but I report fever and chills. Something should be ringing and said, look, I need to come up with a diagnosis. Chemotherapy with these signs and symptoms means infection. Well, temperature confirm it. Blood pressure is dropping, right? I'm worried about it. And you look at him, visibly weak. He's getting septic. His mouth is dry. Dehydration. His lung is okay. His abdomen is okay. He has no edema. Look at his white count. So low and ANC of 500. Bad problem. Sepsis. He has temperature of 101.1. Therefore, what do you think? Chemotherapy patient with sepsis. What do you want to do? This is a case study. You may see. It's our concept. You know it. I just put it in the story form. So we're going to figure out what we need to do. The nurse has reviewed the clinical data. Which action the nurse should prioritize? Chemotherapy patient with infection. That's all you care about. Take that information and use it to answer every question. Chemotherapy, infection, fluid. I don't care about it. Antibiotic as prescribed. Okay, do I need culture first? Initiate neutropenic precaution. It sounds much better. Provide warm blanket. Of course, I'm cooling them. What? They're already hot. Why would I give them warm blanket? Therefore, you know I need to prevent further infection. Neutropenic precaution. Patient is having sepsis. Now, put down your answer. Let me know what you're going to put for this. Which room assignment is appropriate for this client? What do you think? Shingles? You put him in the patient with the shingles? Somebody with influenza? Or you place them in the what? Private room with HEPA filtration? Or a room with another neutropenic patient? This is a trap. They should not go in the room with another neutropenic patient. That is the definition of neutropenic. Isolation. Alone. Right? Shingles and influenza, infection, you're going to make them sick. Therefore, by default, is that. That's how you break the answer choice. Which lunch tray should the nurse deliver? I'm testing your knowledge about neutropenic precaution. I know you know the answer for this. Stop the video, pick the answer choice, and put that in the comment and put hashtag 2.3. This is what I select. What food will you give to this patient? Salad with raw vegetables and fruit cap? Gray chicken, rice, cooked carrot. That is the concept. When I say concept about topics, this is it. You're taking neutropenic precaution and bringing it to this question. Medium rare steak and baked potato, yogurt parfait, and with granola. What do you think we should give to this patient? What is the concept to answer the question? Avoid infection. In a raw thing, anything that will cause infection, the thing has to be cooked to the best of all. Therefore, raw vegetables, bad problem. All of this is cooked. Chicken, rice, cooked. Carrot, even the carrot is cooked. Steak is not cooked well. It's medium rare. Yogurt, a bunch of bacteria. Let's go. We're going to go with this. The nurse has provided discharge teaching to the client. It's going home. Which statement indicate need for additional teaching? What did I say you should focus on based on the case? He has cancer patient, getting chemotherapy, now has infection, everything what you're going to do, neutropenic precaution. You see how they test the question? The same thing I'm trying to show you. I'm using every question, go back to the basis, neutropenic precaution. I will avoid large crowd. Is it neutropenic precaution? I will take my temperature daily. Neutropenic precaution. I will wash my hands often. Neutropenic precaution. I can have a small fresh flower pot in my room. What do you think? What do you think? Which one should we worry about? That's all. Which one should we worry about? You say I can have fresh what? Small pot with the fresh flower pot in my room. Of course, if you're avoiding large cloud, that's good. Taking your temperature daily, you're watching for infection. I wash my hands often, that's good. You shouldn't have anything associated with fresh. That's the thing. Whatever it is, I see fresh, I'm picking it. Now I take you to pharmacology. The client is being discharged home after chemotherapy with prescription to increase neutrophil. The buzzword is what? Neutrophil. Therefore, which medication do you think is going to increase neutrophil? Is it ipotine, filgrastim, opravecrine, and methotrexate? What do you think? Buzzword. Pancytopenia. That means your platelet go down. Where does it go? Opravecrine. Your RBC go down. Which medication we give you? Ipotine. Your WBC go down. We give you the grastin. Methotrexate is a chemo agent. It does not increase your neutrophil. It rather decrease it. Therefore, what is the right answer? You can know that we're using the concept filgrastim. It goes on with the filgrastim. Now, there's things you have to know about this medication. The client was prescribed filgrastim. The nurse is teaching the client who will be self-administering the medication. Which one should you include? This is the concept. This one I will teach you, and I will let you know that these are the things you have to know about this medication. Administer the injection subcutaneously as prescribed. It's usually injected through subcutaneous means. You should not shake it, otherwise you make it infective, so don't shake it. Store it at refrigerator to keep it patent, so write it down. These are all things about filgrastim. It's very important. Of course, if you have infection, you should let me know. One of the major side effects is what? It's not major, but it's the common side effect. It's bone pain. That's what the patient will complain about. You should not skip it if your white count is normal. Keep on using it. Otherwise, you get infection. How are you doing so far? Question number 2. I know you ace it, but this is the test taking strategy. I'm showing you how to go through what? Next generation NCLEX. If you need more, check out Adapt NCLEX, a bunch of next generation case study. Watch them, see the way I approach it. Go for the buzzword, the first 2 sentences, and stick with it. And never change your diagnosis. Every question, take it and answer it based on what you find in the case study. Next question. Client, what? The nurse has reviewed the progress note from 8 o'clock, right? Client, click to highlight the finding below that indicate client is not improving post-surgery. We want to know if this patient is not improving post-surgery. What is that? 8 o'clock. Patient is post-op day 3. What? Have what? Splenectomy. Is able to what? Ambulate to the corridor 3 to 4 times. Ambulation. That's good. With minimal assistance. Client has what? Clear breath sound and left-sided chest tube is in place attached to what? Closet closed chest drainage system. They did not highlight it. There is tidally in the water chamber and noted on deep inspiration. When you take a deep breath, you see some tidally in the water seal chamber. The client refuses to use incentive spirometer. It started improving and state it causes left-sided chest pain. Right? Client is using prescribed PCA every hour, so maximally every hour, and continue to have what? Intermittent nausea and vomiting. Adequate urine output is documented. The abnormal incision site is what? With dressing is clean, dry, intact with no erythema, edema, and drainage. You may see this highlighted information. Which one do you think indicate that the patient is not improving? You got to bring your nursing knowledge and use it to answer it. If I see tidling in the water seal chamber, that's good. When you take inspiration, it means the tube is working. That's not bad. If you ambulate 3 to 4 times a day after surgery, good thing. If you refuse to use the incentive spirometer, yeah, I'm not happy with you. If you are using your PCA, no matter what, problem. And your urine output was okay. If you have nausea still, we have a problem. This is the way you will see it in the NCLEX. Step back, look at the thing they've given you and use it. Never bring your knowledge. Whatever he's giving you, stick with it and use it. Next question. Now, we switch gear, starting with what? Management of care. This is prioritization. You know the way I do my prioritization. Divide the thing, go for the buzzword, connect the dot, and use your B sharp. If you don't know what the B sharp is, check Adapting because I have a bunch of video. And what do? I say, you have to be sharp. What I mean, whenever I say be sharp, I mean this. Are you concerned about a breathing issue, electrolyte, shock, sepsis, airway, what? Hypothermia, hypoglycemia, airway, and pain that will kill you, not the pain that you get for headache. If all of this is what you worry about, then you are being sharp. That's the key. That is the key aspect of it. Therefore, what are we going to do? Divide the thing into two. A client is taking amiodarone, okay? And it has a morning AST of what? 250. I give you the range. It's taking clopidogrel, dark black stool, right? And naloprol. What is the problem? Nagging cough. Albuterol, I give you for you asthma, and you have tremor. Be sharp, not expected. Which one would you pick? Put down your answer in the comments. Stop the video, and then put your answer in the comment. This is prioritization. I want you to haze it. Prioritization is everything about the NCLEX. You have to master it, and you have to feel comfortable. If I give you albuterol, it's a beta agonist. You're going to have tremor. If you take ACE inhibitor and naloprol, nagging cough is a warning sign. As you let the doctor know, if it doesn't help, we change your medication to ARB. Clopidogrel is what? Antiplatelet. You bleeding, black tarry stool. Amiodarone, AST is an expected finding. The only thing you worry about amiodarone, I call it pre-Crohn, pulmonary fibrosis. And therefore, which antistress you want to pick? You can see this patient is bleeding. And this is aware of 4 clients who present to the emergency room with flu. All of them are flu. Which client should be seen first based on the clinical findings? Same thing. We all have flu and we came into the emergency room. Who are you going to see first? Well, divide it. He has runny nose and arthralgia, right? After what? What is the problem? This patient, he look like he has flu. This patient has small purple rash after he take allopurinol. You think it's a normal flu? He has bullseye rash after hiking. What do you think? I can tell you this is a Lyme disease, right? And then you give them a flu vaccine and he has flu-like symptoms. What do you think? If I inject you with a vaccine, you're going to look like you have flu. If you have bullseye rash, you're going to have flu-like symptoms. That's Lyme disease. If you take allopurinol for gout, and you have small purple rash and you have flu-like symptoms, Stevens-Johnson syndrome, that's bad. And if you have all these things, you have regular flu. Who am I going to see? Be sharp, not expected. This is sepsis. Bad sepsis, bad sepsis, bad sepsis. you better pick it. Otherwise, NCLEX is going to punish you. This is what you need to do. And that's the explanation. Small purple rational purine, which is a sulfur drug, is Stevens-Johnson syndrome. A bad problem, bad problem, bad problem. Same thing, divided into two. A client with what? SIDH, what do you expect? Leg edema? Somebody with a gastric bypass, should you put them on what? Complex carbohydrate? You see the way I'm reading it? I don't care the way it was written. I'm reading it the way I feel comfortable, and then I can handle it. Spironolactone for hypertension, then I have peak T wave, right? I take Coumadin, my INR is 2.1. What do you think? Let me break it down for you. And let's work it through together. Coumadin, if I give it to you for DVT, what should your INR should be? 2 to 3, 2.1. We're good. Spironolactone, potassium sparing. I see EKG changes no matter what. No matter medication you're taking, and you take it and the EKG changes, we have a problem. You are being sharp, right? Electrolyte. What? Gastric bypass? What do they need? They should avoid damping syndrome. What should they avoid? Simple sugar. It's on carbohydrate, complex. Good. SIDH, you retain water, you have edema. What should I worry about? Nothing. The only thing I should worry if you are having seizures. Therefore, I'm picking number 3. And I know you pick the same thing. Same thing. 4 hours after AAA repair. What is that? The urine output is what? 30 ml every hour for 4 hours. So it's making urine every hour, 30 minutes. It's doing okay. Client admitted with CHF and he reporting what? Leg edema. If you have CHF, should you have leg edema? Ask yourself. If you have absolute neutrophil count of 200, that means your white count is too low that you're having chills now. Is there a good thing? And if you have diabetes, A1C is 9, okay? A1C is 9. More than 6.5, that's or 7. And your glucose is 200 in the morning, should I worry about it? Your sugar is on control. I don't expect your glucose to be normal. And therefore, I know this patient is in trouble. CHF patient, your leg is going to have edema. AAA patient, and you're making urine, you're good. We just have to move forward. Same thing. Who should be seen first? Prioritization, management of care. Who do you see first? A client with cholecystitis, an infection, right? White count of 25,000. Should you worry about it? The client fell. He has left-sided chest pain. All of a sudden, tracheal deviation, jugular vein distension, bad buzzwords. Client, he had what? Cardiac catheterization. What you worry about? Bleeding. Is complaining of back pain. CHF, he has what? Pink fluid sputum. Oh, that's a bunch of stuff going on. Which one would you pick? I want everybody to try. If you're watching this video after this, thank you for staying. But I want you to put your answer choice here. This is a good prioritization. I put it together so that you can know that we have to be sharp. And the B sharp, it doesn't mean the B is more than the E. It just means pay attention to them. And let me use them to show you what the B sharp means. Cholecystitis, and it's an infection. It's white count is the, that is sepsis. That's the S. Patient fell. He has left chest pain, tracheal deviation, and jugular vein distension. This is tension pneumothorax. Tension pneumothorax is an airway problem. It's not like he can't breathe. The airway is being collapsed. If you have cardiac catheterization and you complain of back pain, it's bleeding. That's bleeding problem, right? You see sepsis, airway, bleeding. And if you have what? CHF and you have pink fluid sputum, you're drowning. This is a breathing problem, right? So breathing, bleeding, airway, and sepsis. Which one will you pick? ABC does not work here. It's just based on the condition. Of course, tension pneumothorax is dangerous more than somebody who is bleeding or is breathing or who has sepsis. We have no time with this tension pneumothorax. Therefore, we're picking this guy. And I know you got it. And then it's assigning what? Client to an experienced LPN. This is LPN assignment, delegation. We now on delegation, part of management. Good. Who would you give it to? LPN, MMR most medication, right? They can reinforce. They don't provide initial teaching. They're reinforcing the teaching. They can give most medication. They can do stomach care and specialized tests, right? Predictable, right? Client with COPD, he just needs his inhaler. What do you think? You don't want to give it to the LPN? I will give it to him if you don't want to. 2 hours post mastectomy requiring initial. The word initial does not include in the language of what? LPN, negative. Client with diabetes who need routine insulin administration and blood glucose, they can do that. Client with new onset confusion, new, away, fever, he need require antibiotic, negative. Client on warfarin who need education about dietary, education, out. Is the RN who provide education, initial education. Client with hypertension require reinforcement. The word reinforcement is in the vocabulary of what? The LPN. And this is the way I do this delegation and assignments. You just have to go with the words. I play with the words, and you don't let them take that from you. Community health, right? This is management of care. A community health nurse is planning an intervention for preventing what? Childhood obesity, which action demonstrates primary prevention. You have to know what is the primary, secondary, tertiary, and quaternary. What is the primary? What is the main idea of primary? It's things you do to prevent it, right? Like you go and get vaccination, right? You don't want the disease to come. You doing things to prevent the disease from coming before it gets to you. Secondary is you screening for it. Therefore, screening children for body mass index, I told you, screening, secondary, right? It's not that. Providing nutritional education to school children, hey, you give them something so that they can eat better, so that they don't get weight, right? Treating existing obesity related, that means they already have the disease and you treat it, you're doing tertiary problem. And managing diabetes in obese children, that means you don't want them to get worse. That's quaternary issue. And therefore, providing nutrition isn't a primary prevention. You prevent it from happening. This is the way you can use this community health issue. If you have questions about it, take Adapting class. I have a bunch of videos you can watch. And thank you for staying. We're on question 10 on what? We're doing management of care, client need, English practice question, 85 question. We're going to go through and I'm going to show you some of the things that the English asks you. You will see that physiological is what take 50 to 60% of your, it takes about 60 questions, between 50 to 60 questions of the 85. If you master them, you're going to ace it. And you will see that most of the questions will be physiological adaptation. A stroke patient has hemiparesis, facial weakness, non-productive core. It's a stroke patient. Don't worry about it. I intentionally give you a bunch of buzzwords. Who do you want to give it to? The buzzword is stroke. If you have stroke, what should be the number one thing you should worry about? They have paralysis, facial weakness, non-productive core. Do you think they care about using their hands? Using their whole body? Respiratory or speech? Which one? Aspiration is number one for a stroke patient who have all these things. And therefore, who is going to do the aspiration test? Who is going to be in charge and help us see if this patient can eat? Speech pathologist. Very, very important. Number 12. A client present with what? Diarrhea, abdominal bloating, and what? Weight loss. And lab show what? Iron and folate. You see, we get into areas that are very, very important to make a diagnosis and figure out what is going on. Which condition should the nurse suspect? Which condition should you suspect? Diarrhea, abdominal bloating, and weight loss. And the lab shows iron and folate. To have diarrhea, abdominal bloating, and weight loss means absorption problem. And if you have iron and folate, you're not absorbing anything at all. Which one should you suspect? Use the buzzword. When it came to GI diagnosis, always go with the buzzword, not even GI. And let me show you. There's a big word you can use. What is irritable bowel syndrome? We call it alternating constipation and diarrhea. Do you see it here? Negative. Crohn's disease. What are they going to tell you? Diarrhea. They may have some anemia, but they will tell you this individual will be on immunosuppression or they may have fistulas. Negative. What is this person going to show? Bloody diarrhea. There is no bloody diarrhea there. Therefore, celiac disease, weight loss, malnutrition, folate iron deficiency. This is celiac disease. This is NCLEX study questions to help you pass. And therefore, let's continue. And nurse is aware of several clients on what? The respective prescribed medication, which drug combination the nurse should question, select and apply. Which of these you should question? What do you think? Furosemide and ibuprofen, lithium, chlorothalidone, digoxin, furosemide, allopurinol, and benztropine, spironolactone, and what? Salt substitute. What are we doing? What do you think these questions are? We're preventing risks, right? We're trying to figure out what is going on with them. So we're changing gears, and you can see how this is coming. Furosemide and ibuprofen. Well, if you take furosemide, we're trying to get rid of your fluid. And if you take ibuprofen, it will let you retain. Therefore, I need to question. If you take lithium, dehydration is a problem. If you take chlorothalidone, you're going to get dehydrated. It's what? Hydrochlorothiazide is that derivative, diuretic. We have a problem. You see what I'm doing? I want you to do that. Digoxin, well, what causes digoxin toxicity? Low potassium. Oh, furosemide causes low potassium. I'm picking you. Allopurinol, what is the side effect? NMS and an EPS. Oh, benztropine is anticholinergic. We use it for EPS. Oh, good job. They're doing good combination. Spironolactone, I'm going to spare your potassium. If you take salt substitute, we are retaining potassium. We have a problem. And therefore, that one, we're going to question all of them. You see, that's the way you go about writing and going through each questions. Now, the client report right lower quadrant pain, risk reduction, right? Fever, anorexia, and nausea for 24 hours. What do you think? Buzzword, right lower quadrant pain, fever, anorexia, and nausea for 24 hours. What does it tell you? There's only one thing in your right lower quadrant. Don't pick anything that you don't know. What is here? Right lower quadrant is here. Your right side is on the left side of the screen. So this is the what? This is your left, but this is patient right. And therefore, this is right lower quadrant. There's only appendicitis here. Now, which finding is concerning? Sudden relief of pain. Is it a bad thing when you have appendicitis and you have sudden relief of pain? Pain, where's at McBurney's point? Well, McBurney's point is 2/3 from the ASIS, right? If this is the belly button to the right here, it's 2/3, right here. That's where the appendix is going to lay. You're supposed to have maximum pain there. If you have fever, 101.5, unexpected finding. Anorexia, unexpected finding. But if you have sudden resolution of your pain, we have a problem. That means we have rupture. And that is a pre-problem. We got to see you. And next is assessing a client with what? Rheumatoid arthritis. And arthritis associated with rheumatoid, which assessment finding is characteristics of what? Rheumatoid arthritis. Should the nurse expect? These are concepts. If you know them, it's easy. Now we're dealing with the patient with rheumatoid arthritis. You got to distinguish it with what? Osteoarthritis. And that's what the NCLEX will ask you. This one slide, it's all you need when it comes to the difference between them. It's going to show you, what do you think? Morning stiffness relieved by movement, large joint movement, large joint involvement, unilateral joint swelling, elevated rheumatoid factors on lab, presence of uric acid crystal. What do you think? Rheumatoid, small joints, little joints, right? Therefore, large joint is not involved. Major problem is stiffness, but when they move, the pain improve. You see the difference between them? Therefore, this one I'm picking it. Is involved both joint, unilateral. Therefore, I'm not picking C. Rheumatoid factors is going to be elevated because it's autoimmune disease. And the presence of crystals are associated with gout. That's the difference between rheumatoid and osteoarthritis. Osteoarthritis, large joint, unilateral, and when they move, they have more pain. Mommy said, oh, my knee hurt all the time. They don't want to move. Rheumatoid, it said, my knee hurt. If I move, it get better. That's the difference. That's how you can find the difference between them. Straightforward questions to show you some of the difference between them. We are number 16. How are you doing? What is your score? I want you to put down in the score and let me know how you're doing. Like I say, stop the video. You can watch this video multiple times, but watch it and then take information that I'm saying. Just write it down so that you can learn from it. I'm not just giving you the questions and the answers. I'm using it to teach you that these are little things. All the concept, I want you to write it down because when you see the question, it should pop out like you that, oh, I know about rheumatoid and osteoarthritis. And that is the way I do questions and answers. I don't want you to just listen to the question, but I want you to write it down and say, oh, this is what I need to know about it. What is about this patient? A client with systemic lupus report what? Fatigue, joint pain, molar rash. That is the diagnosis of what? Lupus. Just giving you, breaking down the question so that I'm showing you how I answer the question. Joint pain, molar rash, and fatigue is what? Lupus. What is the next priority assessment? This is the way I will read it if I'm taking the test. I'd start from the back. What is the next priority action? I circle priority. I said, I need to pay attention. Everything here may be right, but priority. And I said, who? Lupus. He has fatigue, joint, molar rash. That's all associated with lupus. And I said, what should I worry about? Is he taking his steroid? Do I check the kidney function? Do I check the blood pressure? Or wait? I said, if you take steroid, autoimmune, you're going to gain weight. Your blood pressure will go down. But lupus, number one thing that kills them is their kidney function. The presence of lupus nephropathy, that means if lupus affects your kidney, you're screwed. And that is what the NCLEX will ask you. I'm showing you some of the key clinical aspects. That's what NCLEX asks. They ask clinical application, not just memorization. So lupus, every time you hear about lupus, think about, is the patient renal function working? 17. 6 months old, present with what? Abdominal pain, carrying jelly stool, vomiting, abdominal distension. I'm using this type of question to show you test taking strategy and energy generation. But I'm changing it to the client's need. I give you a bunch of symptoms, connect the dots, and it said, which action should the nurse prioritize? If you look at the information given, put it together. What is a 6 months old? He has abdominal pain. It's intermittent. Carrying jelly stool. It's a buzzword. Should ring in your ear. He vomit and he has distension. If you connect all of them together, what does it give you? That is the question. Carrying jelly stool, abdominal pain, vomiting, distension in the 6 months old. This is what? Interception. If this is interception, what should you prioritize? Give them antibiotic, give them oral fluid to prevent dehydration, prepare for barium enema, and prepare for surgery. You see the concept? I've given you GI interception concept. If they give you a case study, this is the same thing. If they give you standalone, this is what you have to know. What do you think? Interception. We got to take away the telescoping. How do we do that? Or barium enema. Of course, we'll give you some antibiotic. Of course, we're going to give you hydration, but we're not going to give it to you orally. Of course, you may need surgery if the reduction with barium enema does not work. That is the second way. Don't pick number 4. Please don't pick it until you clear them with barium enema and air enema. Surgery is not indicated. Number 18, a nurse is caring for a client with what? Severe salmonella infection. Which medication should the nurse anticipate for client with severe salmonella infection? This one, you just have to write it down. Salmonella is a common GI symptoms that happen from food, infection, and other things. Specific medication that work is penicillin. Acyclovir is for viral medication, infection. So therefore, you cannot pick it for salmonella. Tetracycline are used for different organisms, and vancomycin is a severe staph infection. Therefore, A is the right one, just to give you the information. A 12-hour post-appendectomy as abdominal bowel sound. Risk reduction, pay attention, risk reduction. This we're preventing risks, right? Absent bowel sound, distended abdomen, and mild fever. What would you do to prevent risks, right? That is the definition this client need. When you see the question like that, that's what should you do first? A, he has surgery. He has all these symptoms. No bowel sound, is distended, he has fever. What would I do first? I document the finding, I let the doctor know, I let the patient walk, give them medication. All these combinations are bad. Giving them analgesic is not going to solve things. You're just maxing the issue. Let them walk. They're not going to walk with these symptoms. You should let the doctor know. And then provide digital teaching to a client with what? Secondary Raynaud disease. That means vasospasm of their hand. Which occupational issue should the nurse advise the client to avoid? Which educational? Which one? Which occupational issue should the nurse advise the client to avoid? Remember, Raynaud's disease is what? Vasospasm, and due to vasospasm of the vessels in your hand, and usually cold exposure is number one, or extreme cold or heat. But one condition is not due to driving. I'm going to give you the answer for this. Teaching indoor, office work. Teaching indoor, you stay indoor, less cold, right? Driving, you don't usually causes vibration of your hand too much. Anybody who use vibrating tool, the vessels in the hand can rupture, and that can cause ischemia, and it can cause vasospasm. It's one of the most common causes of secondary Raynaud. So watch it. When you see a question about Raynaud, ask about occupational, and occupational, anything that causes vibration is a problem. 20 questions so far. What do you think? How are you doing? What is your score? Put it down and say hashtag number 20. I get so and so over that. But I know you get 20 out of 10. I thank you for staying. But we are going to 85 questions. We have done 20 so far. If you need a break, take a break, drink some water, stop the video, come back, and let's hammer these questions and learn these concepts. You take a pen and paper, write everything down, and let's go. 21. What are we doing? A client with acute kidney injury ordered the following meal for lunch. Risk reduction. And this is what you see, and you don't know what to figure it out. This is what I want you to know. Which food should the next question? A, you have kidney problem. You should not take anything that will make you sick. What is the number one? Too much potassium or too much sodium, because you can't get rid of your fluid. You are fluid overloaded, so don't give in sodium. You can't get rid of your sodium, potassium. A, don't take too much potassium. What do you think? Apple, chicken, white rice, avocado. Which of these has a bunch of what? Potassium in? Avocado. That's the best way to remember them. The easy way to, I tell people to remember high potassium is what? Fast, right? Fish, avocado, strawberry, tomatoes, those are all higher in what? Potassium. And next, as a standard staff education program on psoriasis, which when teaching a client with psoriasis, which factors the nation and no exacerbate psoriasis. Psoriasis is autoimmune disease. The certain condition NCLEX will ask you, it causes problem with patients with psoriasis, and you have to provide teaching for them. I want you to write this down. Anything that stresses the environment affects your immune system, and that can cause more problems. Lithium, they hate psoriasis patient. Beta blockers also causes what? Exacerbation of psoriasis. And moderate sun exposure, the more you expose yourself to sun, the better. And skin trauma worsening. Therefore, this patient, you want to avoid biopsies and other things, and those can cause a problem. But the need sun exposure, the UV light can destroy the psoriasis. So it's very, very important. Another patient, an infant is born with what? Myelomeningocele. You know what it is, right? What is the next priority intervention? These are spectrum of spinal bifida. That means the kid is born in the spine, there's a sac with some fluid there. What do you want to do? Place the infant in the prone position and cover with the non-adherent dressing. Immediately feed infant and check their temperature. Place infant supine and cover with non-adherent dressing over the sac. Start IV fluid immediately and drop raw culture. I will show you some test-taking strategy. We're preventing infection, right? We need to start IV antibiotic and black culture. That's good, right? But the question said priority. If you pick number 4, you forget to mention that in the question that we worry about priority, even though we worry about infection. Number 1 thing, look. The second thing, look at A and B. One said prone, one said what? Supine. They're saying the same thing. That means they are the right answer. B and C, D are wrong. Which way would you put the patient? If the thing is on your back, place on the front so that we don't have rupture before we can worry about any other thing. And next is performing assessment of a client in the emergency room, which description best fit an arterial ulcer. What do you think? There's a type of ulcers, PVD and PAD. And PAD, you can have ulcers. And in PVD, we can have ulcers. Arterial and venous ulcer. What is the difference between them? If you don't know this, I want you to spend time. Stop the video. Listen to what I'm going to say. Write it down. Different kind of ulcers. If it's a source of artery, think about it. Don't memorize. If you memorize, you forget. If an artery causes an ulcer, that means blood is not going to flow. That ulcer is not going to look red. It's going to be like really dark, right? Punched out color, kind of symptoms, right? That is the key, right? The edges, what do you think? It's going to be what? It's not going to be shallow, right? It's going to eat down. You go all the way to where it's not supposed to go. That's the problem because things are dying. You see what I'm saying? Therefore, painless and heavy draining because there's no blood flowing there, right? So heavy drainage, if there's heavy drainage over there, there's a bunch of fluid going there. There's less blood flow, so you're not going to have heavy drainage. You see, that's the number 1. This is the way you break down this particular question. It's usually located in the lateral aspect, not the medium. So it's good. And because there's less blood flow, there's going to be minimum drainage. So this is good. I picked this one. It's shallow. It's supposed to go deeper because of the ischemia, and it's not on your sacrum. Therefore, it's gone. This one say it's wet. It's gone. You see what I'm doing? And this one say heavy drainage. It's gone. The key features is painful, it's punch out, and it's on your toe, and it's on the lateral aspect of it. Therefore, which one is the right answer? It's this guy and that guy. This is arterial ulcer, difference between that one and a venous ulcer. So arterial ulcers are ischemic, they're painful, they're poorly perfused, different from that of a venous ulcers, and they do not have drainage on it. A client presents with a large thermal burn, right? What do you want to do with this patient? Injury, prevent further injury. After removing the burning source, what do you think? This is the same thing I should have asked you, emergent, active phase, and all the phases of burn. After you take away the problem, what do you need? IV fluid, IV fluid, IV fluid. Write it down. Not ice is going to worsen it. Cover the thing with ointment. No, the patient has a burn. You need resuscitation. We should allow client to rest. Of course, we're going to allow them, but priority require IV fluid. The 4-year-old A 4-week-old infant present with what? Projectile vomiting after feeding and visible peristalsis for 3 days. What do you think? 4-week-old, buzzword. Projectile vomiting should trigger something in your head and say, feeding and visible peristalsis for 3 days. Which of the following the nurse should anticipate? What do you think is wrong with this patient? Connect the dot. I want you to put down in the comment and let me know. This young kid, projectile vomiting, something should tell you the problem. After we feed them and there's peristalsis, what is going on? This is what? Pyloric stenosis. Every time you see pyloric stenosis, what should be the next thing? Dehydration. And therefore, every answer choice is a dehydration. What should I anticipate? What? Dry mucous membrane. Excellent. I'm going to see that. Is that true? Yes. Capillary refill, less than 3 seconds. It means what? Heart rate of 80. What do you think? Does it mean dehydration? Blood thinks stool. Does it mean dehydration and what? Pyloric stenosis? Low pitch cry. Does it mean dehydration and pyloric stenosis? Metabolic alkalosis on ABG. What do you think? I want you to put your answer. Like I told you, if you see pyloric stenosis, dehydration. Dry mucous membrane, dehydration. Capillary refill less than 3 seconds, it does not mean dehydration. It should be greater than 3 seconds. Heart rate of 80, that's normal. Blood thinks stool, this is intussusception, no pyloric stenosis. Low pitch cry, that's a neurological problem. Even when the kid is what? Get dehydrated, this usually rarely do they happen. They become irritable. And metabolic alkalosis is what you see when they're vomiting or the acid. Therefore, this and that. Every time you see this question, think about dehydration. And that's the way they will take you. You see how we can answer this question based on the content, based on the information given. During labor, the umbilical cord is visible outside the vagina. We want to prevent risks. What do you think? Which action you should take? Risk reduction, take it away, and prevent further injury, right? Elevate the presenting part of the cord manually, prepare for vaginal delivery, encourage pushing, administer Pitocin. Well, cord prolapse, no more pushing, no Pitocin. We don't deliver the baby while the cord is prolapsed. Gently elevating, place the patient knee to chest, and then we take care of the mommy. All these questions, I'm testing your knowledge. This is another one. You can see that we switch gears. We're talking about a bunch of what? Health promotion questions. And this is the way we're doing it. You can see when they come, you can tell, try to figure out what kind of question they ask you. But all of them is under what? Physiological adaptation. And this is the key. A client at 36 weeks gestation present with sudden, painful vaginal bleeding and fetal tachycardia. Those are all buzzwords. Sudden, acute problem, painful. It's going to be painful. Fetal tachycardia. Baby is in trouble. What would you do? Do you think it's what? You got to make a diagnosis. If it's painful, what do you think? If it's not painful, what do you think? Painful vaginal bleeding is what? We have a problem. Sudden, painful vaginal bleeding and fetal tachycardia. Mommy is in trouble. We're not going to document the finding. Mommy is not going to ambulate. Peripad only, no way. We got to check fluid and monitor the mommy because mommy is in trouble. We have a situation where we have placenta abruption. That's the key. Brown, sudden onset of painful vaginal bleeding and baby is in trouble is that. 70-year-old woman present with what? Lower back pain. His bone density is that. I can tell he's low. She take calcium and vitamin D regularly. What? Health promotion. At home, he has throw rags and poor lighting. Which action should the nurse take to prevent what? Risks, right? Which action reduces fall risks? Homie, right? Health promotion. These are little questions that they always trap you with. This is the typical health promotion. We want to prevent mommy from falling. What do you think? The T-score of what? That level negative 2.9 is osteoporosis. So how am I going to prevent you from falling? Throw rags, remove it. More vitamin D. Of course, grab a bar on your bathroom so that you don't fall. If you're preventing osteoporosis, moderate, no high impact aerobic exercise. And of course, something that will prevent you from falling. Wear non-slip footwear. These are questions to test your knowledge, and this is explanation is health promotion. I'm breaking it down, like I said, 85 questions. The way the English write a question, they take you up and down and try to disturb your brain. But if you stay focused, you got to be like, read the question and know that, oh, this is what I'm doing. I'm health promotion. Same thing. This is health promotion. A nurse is caring for a client who had gastric bypass. What are you going to tell them so that things can go well? Which teaching the nurse should prioritize at home. Gastric bypass. Before you answer the question, find out what you need to do. Come up with your content and use it. I keep on saying that. Don't answer the question. Gastric bypass, what should be your number one? Write it down. Dumping syndrome, dumping syndrome, dumping syndrome. In the NCLEX dumping syndrome, they're going to ask you. Therefore, what should you prioritize? Dumping syndrome. Drink plenty of fluid with your meal to prevent reflux. No, too much fluid will cause dumping syndrome. Lay down at least 30 minutes after eating. Oh, it may help with my dumping. Eat 3 times a day to prevent bloating. That means large meal, dumping syndrome. Eat food high in simple sugar. That means a lot of sugar, dumping syndrome. I'm picking number 2. A CCO will present with diarrhea, abdominal distension, and poor growth. Remember, if you look at it, we've seen this question already. He's a young kid, diarrhea, bloating, and he's not growing. Which dietary change is a priority? Health promotion. I take the information that you know, and I turn into health promotion question. You got to make a diagnosis. Diarrhea, abdominal distension, poor growth is what? Celiac disease. What diet would you give them? High fiber diet, not for celiac. Barley, oat, and wheat, they should avoid it. Corn, potato, rice, I like CPR. High protein, high fat, and low glucose, that's cystic fibrosis. I'm trying to trap you. Therefore, this patient, this is for celiac disease patient. And then provide teaching to a client with reflux, health promotion, which instruction should the nurse prioritize. Once again, prevent reflux. How do you prevent reflux? Prevent any irritant, anything that causes reflux. Lay down after meal. Would you prioritize that? Avoid large meal and eat slowly. Drink soda with meal and skip breakfast. What do you think? The only thing that causes reflux is irritant and what? Excessive distension of the GI tract. Laying down after meal will make you reflux more. It's not damping. Avoid large meal and eat slowly. That's the best answer. Drink soda is an irritant. You should not skip breakfast. And this is the examples. Irritant, like I call them the cat. Caffeine, alcohol, tobacco, anything that are caffeinated drinks and spicy food will worsen it. 33. How are you doing so far? What is your score? Let me know. Put down in the comment. Say I'm at 33. I'm taking a break, but I'm coming back. Put it down. Write it down if you have to take a break. Otherwise, grab something to drink and let's keep on going. Number 33. A nurse is evaluating a client in clinic. Prescribe what? Lithium for 1 year. Which clinical data the nurse should review before discussing the plan of care with the provider. Health promotion. What do you think? You know, whenever you see lithium, you worry about what? Dehydration and sodium. Do you see any dehydration and sodium in the question? Renal function, thyroid function, basic panel, hematocrit, and coagulation factor. Put down your answer, let me know. You know you've been studying for a long time. Have you seen lithium relationship to what? Anticoagulation, You should not pick it because you think it's one of the worst one. If there's anticoagulation, it doesn't relate to anticoagulation, then why do you have to pick D? Bleeding and hematocrit getting lower. You should not pick either. If I'm worried about sodium, metabolic. If I'm worried about dehydration, kidney function. And since lithium causes thyroid problem, thyroid function test. Concept connected in to answer the question. There's no magic. It's just master the concept, know them, and when you see the question, make sure you understand the stem of the question, and that will be all you need. And this is one of them. Think about it. A nurse is assessing a 2-year-old client in the pediatric clinic. The nurse noticed a strong fencing tonic reflex during the assessment. How should the nurse document this finding? It's a trap. When they give you a pediatric patient, look at the age when they're referring to reflexes. A 2-year-old should not have a primitive reflex. That's all. It's a long question, a bunch of words, the concept needed. After 1 year, there should be no primitive reflex. And therefore, presence of primitive reflex after 2 years or at 2 years, it's an abnormal finding. What are you going to pick? Neurological problem. It's not musculoskeletal. It's usually neurological problem. And so this is the way you can answer the question using the concept. And let's get it down. Number 35. A client receiving IV chemotherapy report this temperature. We saw it in the case study. What is the next priority? A chemotherapy, infection, sepsis, neutropenic precaution. What do you want to do? Prevent further infection. Do you give the patient antipyretic? Are you covering it? Do you let the doctor know? Do you draw a blood culture? Or you document and monitor? Which one would you pick? And then let me know why you pick it. We can tell that we're not going to cover the problem. So we're not going to give them medication initially. Number one is gone. We know we cannot wait for this and just monitor because patient has sepsis. And therefore, we left with B and C. But what should we want to do? Chemotherapy with fever, you alone should not know the problem. There's some situation in your NCLEX when you see a question, nursing school, sometimes you got to call the provider. You got to load the boat. Drawing a blood culture means you are assuming that this problem is yours. It's not yours. Let the doctor know, and then they can give you orders. This is a bad problem. The client taking what? Furosemide state, I would drink as much as water as possible to prevent dehydration. It's a trap, right? How should the nurse respond? Furosemide, you lose a lot of fluid, so the patient say, want to drink. But then, what do you think? This is correct. Drink extra fluid. Do not increase fluid intake excessively. You should take it before bed. You do not need to monitor your potassium. Well, we got to monitor your potassium. If you drink too much, you're going to dilute your sodium. You're going to get into trouble. Excessive too much is wrong. You should not do that. Just because you do it, you can have water intoxication that can cause problem. Electrolyte imbalance issue. The client begin Velasafin. We're switching gears to what? What do you think? Pharmacology, right? Velasafin therapy. Which of the following require immediate provider notification? Patient taking Velasafin. What do you think? Hypotension, nausea, and drowsiness. A bunch of bad stuff. The best way to answer the question, if you don't know something like that, pharmacology, is go back and say Velasafin. Falafacin. How would I know what is this? Well, I can tell you this is SNRI, right? Serotonin norepinephrine. It's an antidepressant. And you know, serotonin and norepinephrine is what? Monoamines. Monoamines causes your blood pressure to go up. And that's how you answer the question. It causes blood pressure to go up. That's why MOIs causes hypertension. Therefore, Velasafin, which has serotonin and norepinephrine, receptor inhibitor uptake, I'm worried about hypertension. We are on 38, almost close to 40, and we'll be there very soon. And then a client is diagnosed with a C. diff infection, constitutive deficit. This is pharmacology. This is one of the hardest ones. Most people have problem. But look, you have to master the medication. Don't memorize it, associate them. C. diff, how do you treat it? Do you give what? Ampicillin, acyclovir, metronidazole, and tetracycline. Write it down. If you don't know it, there's two medications you should know for your NCLEX or nursing school when they talk about C. diff. And that is what? Metronidazole and vancomycin. Write it down. It's very, very important. If you don't know, that is the medication you use. And if the NCLEX asks you, it will be straightforward question like that. There's no tricks about it. This is very interesting. Take some time about it. If you answer it right, that means you understand relationship between lithium and sodium and why we provide those teaching to them. You connect all the physiological adaptation questions you may see. A client taking what? Lithium report recently reducing sodium intake. Okay, we have a problem. Which statement explains the increased risk of toxicity? What is the relationship between sodium and lithium and your kidney? It's a lower sodium decreases what? Low sodium decreases lithium excretion. A low sodium prevents lithium from working. A low sodium improves kidney clearance. A low sodium is safe with lithium. Let me tell you, I know you know this long time when you do your chemistry, you know lithium and sodium, they are in the same group 1 metals. That means they can exchange each other. If you lower your sodium, lithium is happy. The kidney need to have positive charge. Sodium has what? Positive charge. It needs some positive charge where? And the only way you can get it is to reabsorb more lithium. Therefore, a low sodium means I'm going to increase my lithium level. The kidney will absorb all of them. And therefore, which answer choice explain that? That when you have low sodium, kidney is going to increase absorption of your lithium. I change it. If you look at the answer carefully, let's look like well, low sodium is safe. It's not safe. Low sodium improve kidney clearance. No. Low sodium prevent lithium from working. Well, it's going to increase it. Therefore, this. Decrease lithium excretion means increase reabsorption. And that's why it's very important. It's one of the hardest questions, but if you understand it, it's easy. Pharmacology. I made the farm straightforward, but some medication you may not be familiar. So write it down. A client I use it for conditions that is common. A client with multiple sclerosis is prescribed baclofen. Go back and ask you, what is multiple sclerosis problem are? Then you can find the answer. Which assessment finding indicate medication is effective? Multiple sclerosis, do they have increased muscle rigidity if they take that? Decreased muscle spasticity, or what? Increased deep tendon reflex. What do you think? The biggest problem with this, what do you think? They have a lot of stiffness, and therefore we're going to what? Decrease stiffness. There's medications that baclofen, you can use cerebral palsy and other things. So it's a muscle relaxant. Note that it's used to decrease spastic muscle. And this is caring for a client receiving what? Propofol for sedation. These are hard pharmacologies. If you've never seen it before, write them down. I intentionally put them together. Which findings should the nurse monitor most closely? Now, Dr. NCLEX love pharmacology. So check out Dr. NCLEX. You're going to have a bunch of pharmacology videos. Propofol, what do you think? Hypertension, hypotension, dilated pupil, and tachycardia. If you had surgery before, people have talked about it. Propofol lower your blood pressure. It causes vasodilation, and it causes respiratory depression. What answer choice do you see over there? Which one are you going to pick? I know you watch Adapt NCLEX and you know the right answer. hypertension. A client with coronary disease is prescribed sublingual. Pharmacology. Pharmacology. What? Isosorbide mononitrate for acute chest pain. That is a nitrate. Forget about the name. After placing the tablet under the tongue, the client reports a burning and tingling sensation. I told you this is all clinical questions. I want you to master them. I can foresee NCLEX asking you this kind of question because this is clinical. Patient complain about it all the time. That's why I keep on saying, stop the video, write the concept down, and know it like real life. Apply it so that when you see a question, you know. When you give them nitrate, you put in any other tongue, they complain. They say, oh, it feel like burning and tingling sensation. What do you tell them? The medication may have been exposed to sunlight and lost its effectiveness. Drink a small amount of water after the tablet dissolve. Stop taking the medication until your prescriber evaluates you. A mild burning sensation is expected. What do you think? That is the key. If you feel burning, medication is potent, is active, and is working. If it doesn't burn, it doesn't work. If you expose it to sunlight, you lose the potency of the medication, and it does not burn. So burning is good. And I'm going to give you another question that is going to build up on it. But don't go away, because at the end, we're going to talk about mental health concepts and fundamentals. A client with chronic stable angina is prescribed sublingual nitro to use for chest pain. After taking the medication, the client reports what? Developing throbbing headache. This is the same idea, right? This is the same idea. You're providing some teaching related to the medication. And that's what the NCLEX asks you. Which instruction should the nurse provide? Rise slowly from sitting or laying position. Expected finding of the medication. You may take acetaminophen for the headache. Is it an expected finding for the medication? Stop the nitroglycerin until the provider evaluates you. Go to the emergency room immediately. What do you think? They don't need to go. The headache, because it's a vasodilator, more blood go to your head. You're going to have skin's going to flush. You're going to get headache. You're going to get edema. You should change position slowly. These are all associated with the medication. Changing position slowly does not affect your headache. It helps with the hypotensive, orthostatic hypotension that you may experience. Therefore, take something specifically for the headache, and that is acetaminophen. And this is a long explanation. You can take a picture and see what I'm trying to say, but this is the easy way I do for Adapt NCLEX QBank, and this is the questions I usually create as I think about it, as a clinical aspect of it. And this is provided teaching to a client prescribed alendronate. What do you think? This is bisphosphonate. Which medication teaching is appropriate for alendronate? This is how the NCLEX asks you medication question. They list it, and they let you find what is useful. Or they tell you what is useful, and you got to provide teaching. So every time, know the medication and put them in the class if you learn it. Then after you put them in the class, what do I tell the patient? Alendronate, first know that it's a bisphosphonate, and it's used for what? Osteoporosis. Prevent calcium decrease. And therefore, take with meal. Is that what you teach the patient? Sit upright for 30 minutes after taking the medication. Take it at bedtime. Take it with orange juice. What is the number one thing you should know about alendronate? It causes esophagitis. If it causes inflammation of the esophagus, what would you do? Orange juice, you should not take it with it. Usually take it in the morning, an empty stomach, and a full glass of water. And you have to remain upright so that we don't have what? Irritation of the esophagus. Therefore, this is that. 45. A client asks the nurse about sumatriptan for migraine. Once again, pharmacology. Key information. I make it straightforward about it as much as possible. First, you have to know what's sumatriptan. Which statement by the nurse is correct? They're saying something about the medication. Take it at onset of headache. Is that how you take sumatriptan? Take daily to prevent headache. Do you take it every day for headache? It causes severe constipation. Is that the major side effect? It is safe if you have uncontrolled hypertension. Let me know what you think. Number 45. Put down in your answer choice and let me know. We have few questions left, but I want to know what your number 45 is. Don't forget. Remember, all the triptans are abortive. Abortive means you're preventing something. You're not preventing something. You're intervening as early as much as possible. Prevention means you take it every day. Therefore, abortive medication need to be taken as soon as it happens, then you abort the problem. Therefore, this is at the onset, not taken daily. It causes hypertension. It causes what? Coronary disease. It can cause stroke. If you have high blood pressure, you should not take this medication. You see what I've said? Stop the video, rewind it, write the things that I said, and whenever you see a triptan, sumatriptan, pour it down and use it to answer the question. A nurse is caring for a client prescribed oxybutynin for urinary incontinence. Which findings should the nurse report to the provider immediately? Prioritization for the medication. Which one should you worry about? Once again, same thing. First, identify oxybutynin. And I told you first, if they will give you medication and the condition. I give you medication and a condition. Oxybutynin for urinary incontinence. That means you peeing on yourself. I give you oxybutynin is going to prevent you from doing that. It has to be anticholinergic. You see why? That's how you can stop you from having incontinence. Therefore, which one should you worry about? Dry mouth, anticholinergic. Constipation, anticholinergic. Blurred vision, anticholinergic. Absence of sweat with fever, anticholinergic. But the buzzword in the question is what? Provider immediately. A problem is worrisome. An expected finding, expected finding, expected finding, expected finding. But when you have absence of sweating, it's so bad. You have a fever, it's so bad. Now we have what? What do you think? Combine them. Heat stroke associated with what? And we should report it to the provider. That one is bad. That's our problem, right? These are all things you have to put it together when you're doing prioritization question. Otherwise, you'll be guessing. And then she's teaching a client with type 2 diabetes about acarbose. Acarbose. Know this medication, classic medication, because it has clinical implication. Which instructions should the nurse include? Take the medication 1 hour after meal. If you experience hypoglycemia treated with table sugar, this medication may cause diarrhea and gas. Stop the medication if your urine becomes dark. What do you think? Which answer choice would you pick? Acarbose, diabetes. That tells you it's used for diabetes. What is it going to do if it's used for diabetes? It's going to decrease your sugar. Now, let's look at number 2. If you experience hypoglycemia, do you take table sugar? The thing is going to decrease your sugar. If you take table sugar, that's a bunch of sucrose. It will prevent you from absorbing it. Therefore, it's not going to be effective. Take the medication. This medication may cause diarrhea and gas. Why? Because it's preventing you from what? Absorbing sugar. The sucrose is there. That is why we take it with it. Take the medication 1 hour after meal. The thing is going to prevent you from absorbing glucose. Why would you take it 1 hour after you've already eaten? You take it first bite, boom, put in your mouth, and it prevents you from absorbing your glucose. The last one is about the liver. It's rare finding. Therefore, this medication causes diarrhea and gas. What condition you should avoid? Patient with obstruction, patient with bowel disease like irritable bowel disease, UC, ulcerative colitis, they should avoid it. Number 48. A client on Cafe de Law report dizziness when standing. These are straightforward. You don't overguess. I said don't overthink the question. Never overthink that whatever I've given you is what I've given you. What is the next priority? Oh, no, Kaveh the law. It said, oh, the law is a beta blocker. It's going to drop your heart rate. It feels dizzy when it's done. Orthostatic. What do you teach them? Take the medication before meal. Does he answer the question about orthostatic? Rise slowly from sitting and lying. Oh, he's saying something about orthostatic. Avoid grapefruit juice. I don't know, but it has nothing to do with orthostatic. Increased fluid intake is a distractor. You're not solving the problem. Get out slowly. And next is providing teaching to a client prescribed cyclosporin after kidney transplant. You see what I told you? I give you the medication and what is used for. So it has kidney transplant. I give you cyclosporin. That means it's immunosuppression. I know what immunosuppression does to you. But this question asks you specifically about cyclosporin because on the NCLEX, you have pharmacological aspect. And that's why I'm focusing on it. I say physiological adaptation. It has basic care and comfort. It has what? The risk reduction. It has physiological adaptation. And so these are, it has pharmacology also. And that it has pharmacology and all form physiological adaptation. And that's a big area. And therefore, even safety and infectious control are under that. So I will show you later. I'll do a video and tell you the breakdown of areas you should focus on the NCLEX. Now, let's look at it. Which of the instructions should the nurse include? Ensure yearly nasal flu vaccine, avoid large crowd, need for frequent lab draw, use soft Bristol toothbrush, avoid grapefruit juice, need for oral contraception. You will need the medication for 6 months. If you don't know anything about cyclosporin, I want you to stop the video, write this down. I call it sport train. I have a YouTube shot that you can use. It has heavy information on cyclosporin. 60 seconds. The S is skin cancer. I don't see skin cancer there. P is what? Pancytopenia. That means your white count go down, your platelets go down, your RBC go down. Do you see any there? Oh, yearly flu vaccine. So you are neutropenic, you are immunocompromised, flu vaccine. But the nasal flu is what? Live vaccine. You should not take live vaccine. Avoid crowd. Oh, immunosuppression. That's good, right? Need for frequent lab draw. Why? Because it affects your renal, kidney. Yay. We got to check the level of cyclosporin too. Use soft Bristol toothbrush. I don't want you to bleed. Look at it. Oh, gingival hyperplasia. That's sportrin. That's good. Avoid grapefruit juice. It's classic for that. It make the kidney liver not to clear it. Need for oral contraception. T, teratogenic. You should use 2 birth control. Just need for oral contraception is not enough. You have to have 2 birth controls. You will need the medication for 6 months for life. So sportrin, skin cancer, what is that? Pancytopenia, oral form, which is gingival hyperplasia, teratogenic, kidney function, glucose problem, neurotoxic, and of course, everything is associated. So this is something associated with cyclosporin. And what will be the answer? The answer choice said what? Which of the following instructions should the nurse include? What would you include? We should avoid clouds. Reading frequent lab draw. Bristol's stool. And grapefruit juice. We need 2 birth control. It's not enough. We need to take this for life. Yearly nasal flu vaccine is a bad problem. We need something that is what? Not a nasal one. The non-live vaccine is what we're going to use. And this is sportrin. You can take a picture of it. 50. You made it to 50. tap yourself on the back and you say, I made it 50. Put 50 in the in the comment section. Stop the video and put in the comment section and say, I made it to 50. And then she's caring for a client receiving chemotherapy. Thank you for making it. Which action should the nurse implement when administering IV chemotherapy? Select or apply. Immunochemotherapy is very poisonous, and therefore, what would you do? Wear chemotherapy-related gloves. It sounds good. That's what is designed for chemotherapy. Why would I use anything that is not designed for chemotherapy? You see? Use a closed system transfer device. That's a good thing. Disposing of IV tubing in a regular trash. That's like giveaway, right? Wear protective gown. Chemotherapy. Oh, I'm protecting everything. Face, high shield, everything for splash. I'm doing that. Write this thing down. These are all these questions. I designed them to teach you things that you may not see it on YouTube or videos. I put it together and sound esoteric, but the high yield fact you may see. NCLEX practice question, NCLEX review questions and answers on all the client needs. We're talking about promotion, mental health, pharmacology, everything that you can need to pass your NCLEX. You see, pharmacology. Client is on SSRI. It will start working in 1 to 2 days. I will join a gym class. I will stop taking it if I feel anxious. I will take it only when I feel sad. Sad depression. You can't take it when you feel sad. When you feel anxious, you should not stop it. You should let the doctor know. It doesn't take 1 to 2 weeks. It takes like 3 weeks. Why do you want to join the gym? Because it causes weight gain. It's application question. When we test you, if you understand what kind of teaching you provide them, I will join the gym. So that's the right answer. A woman, watch these 3 questions that is coming. I want to prepare you. They're very tricky, but it shouldn't. Likely to make a mistake about it, but get it. Know this. A woman infected with rubella gives birth to a full-term newborn. She already had rubella. The baby is born. Which action should the nurse take? Administer the newborn the rubella vaccine. Promote immediate skin-to-skin contact. Transfer the newborn to the nursing for isolation. Instruct the mother to avoid breastfeeding. What do you think? Put down in the answer choice, let me know. Number 52. Which one would you pick? The concept here is, as soon as the baby is born, rubella infection is no more. You don't get it anymore, right? So mommy, it's rare mommy can transfer into the baby postnatal after birth. At the same time, a newborn cannot get rubella until they are like 12, to 15 months. So that's because they get MMR vaccine. That's not acceptable. Based on that, we cannot isolate them. You should not avoid feeding. And you see how all the answer choices are related? Skin to skin. And this is the concept here. Master it, master it, master it. Number 53. Which patient should be safely cohorted with another? What is the concept? What is the concept? Same organism, not the precaution. Same organism, not the precaution. Rubella, rubeola, negative names. Rubella, sound the same. TB with influenza, not the same. Varicella with MRSA, not the same. What are we going to pick? Rubella. Let it be a music. Rubella. It has to be the same organism, not the precaution. A client is admitted with the confirmed diagnosis, what? Rubella, right? Droplet precaution. Which infectious control measures should the nurse implement? Droplet precaution. Therefore, what do you want to do? Place the client in the negative pressure room. That's airborne. Initiate droplet precaution. Cohort the client with patient with rubella. It's a different, that's airborne. No additional precaution are required. That is not true. And you can see we've switched gears, right? We are now in infectious control and safety. So how are you doing so far? You can see how we switch. You can see the question look different. A pregnant client called the clinic and she was exposed to a co-worker who was later diagnosed with what? Rubella. The pregnant lady has rubella. We are in trouble. And she called. Which instruction should the nurse is appropriate for the nurse to give? Hey, I'm exposed. I think I'm exposed to rubella. And they call the clinic. What do you want to do? Come to your scheduled appointment as planned. Arrive after all other clients have left the clinic. Come in for the rubella vaccine today. Avoid the clinic completely until the baby is born. You see how they can trap you? She's not going to avoid clinic until the baby is born. We have a trouble. She needs to be seen. She's pregnant. She's not going to get rubella vaccine. It's immunocompromised. Now you're left with A and B. Come right now or after. She's really coming later does not affect her exposure. She's scheduled today. See her. Very, very important. That's the concept. These are the 4 questions I want you to know about rubella. NCLEX will ask you. You see in nursing school and NCLEX. So pay attention. MMR vaccine is what? Contraindicated in pregnancy because it's the live vaccine. Exposure cannot be reversed, and then special scheduling does not reduce the risks. Pay attention. This is NCLEX review on rubella and master it. Infectious control. A nurse is preparing to admit a client with a new diagnosis of what? Varicella. With what? Open lesion. That means active varicella. Where do you place this patient? Is it droplet, airborne, or contact? I can tell you, airborne. With open lesion, airborne. But because we have open lesion, and because it's varicella, is what? Active infection, we're going to have contact precaution. So we have 2 things going on. A nurse is preparing to admit a client with diagnosis of Clostridium difficile. Which infectious control protocol is appropriate? Select all that apply. And what did I ask you? 2 answers. Only 2. We have what? C. diff. If you have C. diff, what kind of precaution you want to institute? Contact. Therefore, look at it and say if this is look at it and see if this is a contact precaution. Single-use equipment is a contact precaution. Disposable single-use gown. What do you think? Contact precaution. Face shield, I don't need it for contact precaution. Next, wear N95 masks with routine care. That's no contact. Next, wear gown, gloves. What? And face shield during routine care. Fine, if you want to use face shield, but sterile gloves, no. You don't need to have face shield during routine care. Client door closed at all time is the contact. You have to be touching the patient for you to get the disease. Therefore, that's the only 2 answer choice. These are key aspects of infectious control and safety questions. NS is assessing several clients for suicide. Which client are at highest risk for suicide? We now on safety aspect of the infectious control and safety. Who has risks? Client with a plan to hang himself and access. Client to hang himself and access to means. Client discharged 3 days after a recent suicidal attempt. Client with schizophrenia reporting bags crawling over the skin. Client with depression who suddenly appear calm. Client with panic attack feeling overwhelmed at work. Client who is married and a deacon at church. Concept. If you're married, you have income, you are a deacon, you have social ties, you have families, you're good. Having panic attack and feeling overwhelmed does not make you suicidal. Client with depression, all of a sudden, I feel good, bad problem. Schizophrenia with what? Tactile hallucination is okay. If you just get discharged from the hospital, suicide. And if you have a plan, bad problem. If you're married, problem. If you're unemployed, problem. If you have access to weapon, problem. Watch for that. NCLEX is going to ask you. Those are our suicide risks. Alzheimer's disease, please know it. Alzheimer's disease, please know it. Don't go take an NCLEX without knowing Alzheimer's, because a bunch of people have got these questions regarding Alzheimer's. Not these particular questions, but Alzheimer's, because it's common. Which behavior in a client with Alzheimer's require priority intervention by the nurse? Bad problem. That means you got to intervene. They're asking a lot of questions, repetitive questions. They're forgetting their names. They can't dress themselves and wondering. This is a safety question. What do you want to choose? Once again, safety question. What do you want to choose? It said intervene. That means you want to prevent harm, and it's a safety problem. Alzheimer's patient, they're going to ask you more questions. They're going to forget their names. They don't even know how to dress. If they're wondering, safety, increase risks. And then caring for a client with what? Brachytherapy should do what? Say therapy, radiation therapy, that is mostly internal, right? Stand at the bedside for 30 minutes continuously, you're getting brachytherapy. Do you want the thing to fall? Allow pregnant nurses to care for the client. Do you want them to get sick? Well, let apron and limit time near the client. Oh, do you want to protect yourself now? Pick the radioactive implant when it falls. Do you want to be a radiation therapist now? What do you think? Yes, protect yourself. This is adapting class, trying to make this fun, not make it raw, because this is concept. You got to be comfortable. You got to be willing to absorb it. And I know you got it. I'm making it straightforward as much as possible, but concept, teaching you how to answer questions and make you more efficient when you see question and comfortable. Same thing. Client refuse hospital admission despite provider recommendation. Look at the word, despite provider. That means nobody should be at fault. It's all on you. You see the way I approach the question, the language in the question, 50% of the answer choice is from analyzing the question. Provider provided whatever they need. The patient said, I'm going on. Beneficence, non-beneficence is you doing something for the patient that is causing harm or good, right? Therefore, it's gone. Justice is doing something for the patient. Therefore, I'm using that way. It's not the true definition, but I'm telling you, somebody is involved, not the patient. This is why patient said, I'm leaving. Then all the answer choice should be about the patient. The only thing about the patient is autonomy. The client is prescribed non-weighting bearing on the left leg. How should the client use crutches? Know these fundamentals, how to use crutches. The basics is, I'm not going to read the answer, all the answer choice, but I'm going to show you the basics. It's what? If you have crutches, well, the leg that is non-weight bearing, go with the crutches. And your support is from the leg that is normal. So the one that is normal is what is going to support you. When you progress, move the crutches forward, then the other leg comes through, because that's what supports you. You can't move the good leg and then the crutches later. You're going to fall. You can also not bear weight on the other leg. Therefore, let me know your answer, but I can tell you it's this one. During a fire on a nursing unit, which the nurse should implement which action? These questions are straightforward, right? I intentionally made some of these tricky ones straightforward. You think I'm trying to trip you, but if you have to write the concept during a fire on the nursing unit, what do you implement first? It's raise, and that is what? Rescue, before you pull in the alarm, and then confinement. Then you break down the fire. Therefore, which one is rescue? Boom. Sound the alarm. Well, that's followed next. Then confinement, I close the door and then kill the fire. You think the NCLEX is going to write it like that? They say some people will say, oh, fire, fire. I'm taking care of the fire. Then you forget about your race. The questions are predictable. You just have to stay with it and know how to apply your concept. Which behavior, there's no ambiguity in questions. It's not long, it's going to be brevity, very straightforward, and don't say they tricking you. It is what it is. That's all I've told you. The client has bipolar is in maniac episode. Don't ask me any more questions about it. I ask you which behavior require immediate intervention. Then you go back. Underlying, you said which behavior require immediate intervention. About what? Of a bipolar patient. And so what? Is he maniac? Oh, boom. I know what the maniac make. It's like all over the place. He's on fire. Therefore, if he's talking multiple topics, that's what I expect for bipolar patient maniac. Wearing colorful clothing, well, he just wants to be shown grandiosity. He's spending a bunch of money online. That's what a maniac episode is. But if he's refusing to sleep, physical need, we gotta be worried about it. That's how you answer questions, guys. This is Adapting class. I'm just giving you the knowledge, the understanding, the way to answer question, and try to come up with your strategy and stick with it so that we can beat this NCLEX. We need to pass this, whether we like it or not. This is something we can do. And I say, keep charging as always. I got you. Let's get to it. We are on 65. Few more questions, less than 10 questions. We are done. If you are here, you've done a good job. Thank you for staying. Thank you for watching. Thank you for supporting the channel. I appreciate the comment. And if you love this video so far, just put a little bit comment and say, at this point, that's the only way YouTube can show this video to a lot of people. This is designed to help people out. But without those information, it stays someplace. They call it engagement. But just put a comment so that we can share to the next world. And those who need it, they can pass the NCLEX. 65. Client taking fluoxetine report nausea and tremor. Which action should the nurse take first? Fluoxetine, you have to know, it's an SSRI. Nausea and tremor is a bad combination. Do you let the doctor know? Do you tell the patient to increase fluid, assess for serotonin syndrome, suggest the medication, take the medication with food? Serotonin, SSRI. I don't expect them to have tremor. Tremor and nausea is what? Serotonin syndrome. Assess for more information and let the doctor know. You let the doctor know, but assessment comes before that. What you're going to look for? Clonus, hypertension, tachycardia, diaphoretic, or an assessment of what? Serotonin syndrome. Let the doctor know. A client with anorexia weighed this. This is the weight. 35 kilos, very small in height. Which lab value should the nurse prioritize? Once again, write it. When you see an anorexia patient, they usually, when they get admitted to the hospital, when we start feeding them, what is your priority? Hypophosphatemia. So low potassium, number 1, and low phosphorus, number 2, after you start feeding them. So watch that. So we should prioritize that. Client with PTSD become anxious. And when hearing fireworks, which intervention is the most appropriate? Go back to the PTS, post-traumatic stress disorder. You hear fireworks and then boom, it's blowing up. What do you want to do? Advise the client to ignore the noise. It's a PTSD. Offer medication, anti-anxiety medication. Guide the client through what? Grounded techniques. Encourage discussion about the past trauma immediately. What do you think? The word said PTSD. If you talk about past trauma, you're making more PTSD. Number 4 is gone. You're treating the medication, but you are not going for the problem. You give them medication and they worry about it, anxious about it. Why don't you figure out why? They should not ignore. This will help them cope much better. Every psychotic problem, coping is the better. So guide them through what? Techniques, grounding techniques. This is what I promise you. Mental health concept. All these questions following this is a mental health concept. They are tricky. The answers look the same, but you have to know the concept to answer it. That's why they call it mental health concept. So every question we're going to take, remember, is mental health. A client with what? Obsessive compulsive disorder spent 3 hours doing what? Washing her hands. Obsessive. He has an obsession about something, and therefore is being compelled to do something to take away the obsession. He does it for 3 hours. How do you diagnose them? Are they at risk of infection? Are they having coping issues? Are they have social interaction and disturbed body image? You see how it can be hard? There's no body image issue. They don't tell you they look fat, anything like that. They are risks of infection, but that's the secondary information. The major problem, they cannot cope. Watch it. Coping problem is mostly mental health. There's no social isolation problem. 69. A client with borderline personality, that means borderline personality disorder, show what? Extreme what? Mood swings and fear of abandonment. Mood swings and fear of abandonment. Therefore, they do things, commit suicide, and just threaten people. Which behavior is consistent with that? Avoiding social interaction. It does not say mood swings and fear of abandonment. You see how you answer this concept question? I want you to spend time here. This is why people run away from this. Is the concept. I give you information in the question, and I say extreme mood swing and fear of abandonment. I never say avoid social interaction. Manipulating others to avoid perceived rejection. You see, mood swing, fear of abandonment. Therefore, what am I going to do? I will do things so that I can manipulate the situation. Being perfectionist and rigid. Did you see that in that question? No, she does not want. She's swinging from left and right. You can't be perfect if you change left and right. SBT, no emotional response. Wait, fear of abandonment, that means I should have emotional response. Mental health concepts, they are not difficult unless you overread it. The answer choice in the question. That's what I'm trying to show you. That's what I promise you at the end, that these are the concepts I want you to monitor. Same thing. Narcissistic personality disorder demand constant praises and attention from staff. Which statement best describe it? The same thing. Take what I've given you and reframe it. Constant praises, attention, fear of criticism and avoidance. Do you see that this patient is avoiding? How can you take praises and attention if you avoid people? Grandiosity and need of admiration. Oh, yeah, I'm lifting myself up. Oh, admiration. You got to say something for me so that I can feel good. Social detachment, same thing as one. You can't get away and you expect praises and attention. Unstable relationship, impulsive. Well, they want to get closer to people. Mental health concept. This is the way you answer them. Please don't. The diagnosis question, you got it. I got you with this ones. A client receiving pain medication, make the following statement, which now we change. These are a few fundamentals questions for you to pay attention to that. Which statement indicate the need for further teaching? I will try to take my medication before the pain becomes too severe. I only take pain medication when my pain level reaches 10 out of 10. I know some pain meds can cause constipation. I write down when I take each dose. Which one need further teaching? What do you think? Who teaches a patient to take the medication when they are 10 out of 10? That's wrong. Writing down when you take the dose is good, keeping account of it. If the pain medication causes constipation, so what? I will take my pain medication before the pain begins. It's contraindicating number 2. Therefore, that's good. 5 more questions. A confused client keep trying to remove their oxygen mask. The next are try verbal orientation. Number 1, first orient them. Distraction, I've done that. But the client continued to pull everything, no matter what I do. Distraction, orientation. What is the best, most appropriate next step? Apply self-restraint. Ask the family member to sit with the client. Call the provider for a chemical restraint. Increase sedation to prevent patient from moving. Whether you like it or not, you're going to see a restraint question. And what I tell you, least restrictive, least restrictive, least restrictive, no matter what. Increase sedation, chemical. Calling the provider for chemical, saying the same thing. Asking a family member to sit with them, least restrictive. Applying self-restraint, that's not least restrictive. You see, 1C and D, A, C, and D are saying the same thing. The only thing that is not touching the patient is that. Which of the following client is the most appropriate candidate for a restraint? Who need a restraint? A client who repeatedly get out of bed despite verbal orientation. You tell them, don't get out of bed. They get out of bed. Client with dementia who is wandering the airway. Do you think you need restraint? Client who is violently eating staff members and trying to pull out their endotracheal tube. The client is calling out loudly and disturbing others. Disturbing others does not require restraint. You demented patient who is wandering, you put them restraint, you're going to worsen it. And a patient who is trying to get out of bed despite verbal, bring a 1-to-1 sitter. But if they violent, pulling the ET tube, that is safety. They're going to die from. If they put a tube, airway emergency. So you should restrain them for their own good. And then receive a post-operative client with what? JP drain. Which of the following finding should the nurse report to the provider? Which of the following finding should the nurse report to the provider? Serosanguinous drainage, 50 ml of output in the first hour, bright red blood in the drain, a collapsed JP drain. What do you think? Which one indicate we should report it to the provider? A JP drain, that is Jackson Pratt, is like a grenade. Look like that. And there is a cover here, and there is a lock. So this is where you put the pressure. For it to work, you got to put the pressure here and collapse it. So this is all collapse. So in the collapse form is good. Bright red blood is bad. 50 ml output in the first hour is going to increase. That's normal. If you continue every hour, that's a problem. The drainage is usually serosanguinous. Therefore, we're not going to worry about it. This is a problem. Next question, 75. That means we are on 85. Remember, we do 2 case studies, each of them at 6 points, and therefore we've made it to 85 questions. You should pat yourself at the back. And thank you for watching, and thank you for supporting the channel and staying all along to 85. I hope you learned something. I hope these videos are helpful for you. And if it's helpful, just put a little bit of comment or give me a thumbs up. And subscribe for more content. If you've never subscribed, hit the subscribe button. And then let's get together and HESI the NCLEX. Now, NS is teaching the client how to use incentive spirometer after surgery, which action indicate proper technique. How do you use it? You got to know how to teach the patient. The key is what? Do you blow in or do you blow out? That is all. Do you blow in or you blow out? That means you pull air in or air out. We use it to expand your lung after surgery. How do you expand your lung? You suck in air. That's all. So which one? Exhalation or inhalation? Or blow steadily until the piston rises, or client perform the exercise once per hour, 10 times per hour. Therefore, this is gone. You should know blow steadily until the piston rises, right? The client inhale deeply, right, to expand the lung and do that. This is Adapt NCLEX. Thank you for watching. Thank you for sticking around. And once again, put down the comment. Let us know how we're doing. and good luck in your exams. Keep charging as always. Nursing school or NCLEX. And I would like to know, what is your score? 85/85. Take care of yourself, and thank you very much. Bye.